Good morning, everybody. We are going to get started here fairly quickly because we have a lot of information to give to you today. But we wanted to start with a couple of polls. We have a really diverse group of industry sectors on today. We have some small business owners, large business owners, childcare providers, working parents, and kind of a blend of all of those. So we have a couple polling questions that you should see. The first one on your screen now. We just wanted to get a sense of who's on our call today. And so if you go ahead and we have 3 questions total, so we're going to do about 30 seconds for each poll before we get started, just so we can see who is joining us today. And this question is about whether we're returning to work when your business reopens. And it looks like a good number of people, right, 97% are at yes. And we'll wait a couple more seconds. Okay, it looks like a good number of people have voted and 96% are going back to work whenever that opening date is. The next question is for some of our business owners. If you offer any kind of child care or ECE, early childhood education benefits to your employees, and they can be, flex hours or a condensed work week, or if you're large enough to have an on-site childcare facility, please feel free to go ahead and vote on that. We just wanted to get a sense from our business owners where they are. Oh, wonderful. It's a good diverse group. And if you have answered other, if you feel comfortable or you want to put it into the questions section or the chat, we could share that out too. And then we are going to get ready to close this one and ask our final question. This is for the working parents that we, I think I hit that too soon. Oh, sorry, never mind. Oops, I got too excited. We wanted to know how many working parents were on our thing today, but I hit the close button too soon. So with that, we're going to go ahead and get started. Gigi, did you want to kick us off?
Yes, it's one of those days, isn't it? Welcome, everybody. Good morning and welcome to our chamber chat. This is one of a series of fabulous discussions we've had with our members and members of the community. I'm Gigi Godwin. I'm President and CEO of the Montgomery County Chamber of Commerce. And let me just say before we begin, you are going to see some amazing information today and hear from 2 incredible subject matter experts, but we will send out to everybody who's on on our chamber chat today. We'll send all this fabulous information. It's loaded up with links and all kinds of things, and we'll send it to you after the webinar. So for those of you who are worried about taking screenshots and everything else, don't stress about that. We'll be sending it to you. And we want to say thank you for joining our chat today. The chamber has really enjoyed ramping up this chamber chat approach to being in touch with you. Our webinar series has really been able to provide a lot of opportunity for all of you to connect with some amazing subject matter experts. And that really fits with our mission, which is to connect all of you to the right people at the right time for information that is critical to your success. After all, it is our mission to accelerate your success and also to connect our community and to position ourselves for an ever-changing marketplace. And heaven knows, we are moving into unprecedented time and continue to move through it and into it. So with that, I also want to encourage you to respond, to our speakers and ask questions, because not only are we trying to provide you with information, but your questions inform our advocacy. And that is key to what we do. So when we hear it, from your lips to our ears, and we take it forward. So remember that. So don't ever hesitate to ask a question. So with that in mind, let's get started. Childcare, long since has been a priority for the Montgomery County Chamber of Commerce. We know it's an important business issue and community issue, and we are thrilled to be joined today by Joanne Hurt, Executive Director of Wonders Early Learning, and Sharon Friedman, Director of Montgomery Moving Forward. These two business leaders, thought leaders, two fabulous women, have been longtime friends of the Chamber of Commerce and real allies on advocacy issues that are pertinent to this topic. We've been working very closely together as we did through the last legislative session. And so we are thrilled to have them with us today, since we are excited about the work they're doing and the information they're going to present to you. So now I'm going to turn it over to our fabulous Tricia Swanson, who's Vice President of Government Relations, who's going to give us an overview of our discussion, and then we're in it. We're on to it. Thanks, Tricia.
Thank you, Gigi. We are really, really excited. We love all of our chamber chats, but this one we're particularly excited about because we've heard from so many business owners, from working parents, from childcare providers, kind of this lingering question of, what do we do about childcare? And what you saw in the invite, there was a link to the Washington Post article that really highlighted that even if we had a vaccine suddenly right now and businesses were able to open their doors, unless childcare facilities have the ability to open, working parents can't go back to work. And so we thought that this would be a really timely and applicable conversation, especially given the state's releasing of additional parameters and guidelines earlier this week. That said, this is so much information. So we are really giving you a high-level overview, and we have such a diverse group of people on now that it's going to be a high-level overview both for working parents, for business leaders, and for childcare providers. If after this webinar, when I email out the information, you reply and say, we'd really like more from a working parent perspective, we would really like more of an overview about X, Y, and Z. We are entirely flexible at the chamber to do chamber chats. And so we are always looking for better ways to inform you as our members, as business leaders, as working parents. So please feel free to reach out if you do want more information and if we can be helpful. So with that, I'm going to turn it over to Joanne to get us started.
Hi, everyone. I am Joanne Hurt, as Gigi introduced me, and I've been working in this field for 31 years. And what we wanted to do today is talk about sort of what was going on in our sector of early care and education prior to the coronavirus, and how that has helped to really make that fragile system has kind of been even more impacted by our current stay-at-home orders and this crisis that we're all facing. And so we want to give you some historical look back while we also then look forward to what can be done in the future. So Tricia? So I'm going to let Sharon talk a little bit about Montgomery Moving Forward, because they've been a great cross-sector advocacy group really focused on this issue for the past 4 years.
Thanks, Joanne. Thanks, Tricia. So Montgomery Moving Forward is not an organization. We're an initiative, and we're a coalition of cross-sector folks from education, academia, business, philanthropy, nonprofits, the government, all working together to address the challenges of Montgomery County. And our current challenge happens to be enhancing the system of early care and education. And so before all of us were faced with the recriminations of the pandemic, we were trying to deal with how to have the best possible system in Montgomery County for early care and education, with childcare being premier among the things we were working. So now, as we move forward, we have pivoted a bit in the work that we do, especially our advocacy work, which we'll talk a little bit about today, towards making sure that the critical nature of a return to some kind of normalcy for childcare is happening. And it is, as you all know, and I'll just reiterate, critical not only to the return of the economy itself, but critical to the workforce being able to be back in place and active and ongoing. So with that, let's begin our discussion.
This is just a slide that tells you about Wonders. We're a nonprofit, and we were started in 1976. And our mission is to create and advance high-quality, diverse educational communities that teach children the foundations of lifelong learning and social responsibility. We do early learning and before and after school programming. This talk is going to be mainly focused on early childhood education. So we're ready for the next slide. Okay, so prior to COVID-19, the early care and education sector was already in a crisis. It was an unsustainable business model. Parents really funded the sector, and we'll talk a little bit more about that. Parents were paying a lot in tuition, a huge percentage of their household income, and at the same time, the workforce is subsidizing. And let me just say for a minute, when we say workforce, I want to make sure we're clear. The early care and education workforce, we're talking about the educators and leaders in the sector. And when we talk about the parent workforce, that is, the working parents and the people who are working in our economy outside of the early care and education sector. So the early care and education teachers and caregivers have been subsidizing this sector with low wages. And that has been really the standard across our country because early care and education and childcare has been viewed as an individual issue and choice rather than the public good that it is. And I think that this pandemic has really shown that early care and education is an economic engine for our country. And if we don't have childcare, families can't work. So, in addition to the early care and education teachers subsidizing the workforce, there are expenses that are related to the regulatory environment. We are a highly regulated sector, which is great in a lot of ways because that's to ensure children's health and safety, but there is a cost, and it is really the cost that the individual programs have to bear. And there are inequities in terms of access and support for this industry because historically this has been viewed as caregiving, it's been viewed as women's work, predominantly done by women and women of color, and that has and the inequities across our society are really evident in many ways in our sector, and I think it's really become even more apparent as we're looking at this pandemic and the fallout from it. So, Sharon, do you want to talk about the next slide for a minute?
I will. So, in response to the assertion correctly that parents do shoulder quite a bit of the burden for the cost of childcare, one of the things that Montgomery Moving Forward did several years back, actually at the request of many of our business leaders working with Montgomery Moving Forward, was to try to find out how the money that goes towards early care and education within the Montgomery County framework and also from a state and federal perspective flowed into or lived in Montgomery County. So we did what's known as a fiscal mapping. Now, fiscal mapping is an ongoing activity, and so what you're seeing here is the results of a study that was done last year. But what we do know is that a startling, unbelievable amount of money going into childcare is a parent contribution. So as we think about the future, and the opening or reopening of childcare, we want to take into consideration all of the funding sources that will allow that to happen. And that does include public funding, it includes private funding, but it also includes 81.4% of parent contribution. And so from a total investment in Montgomery County in early childhood, you can see up the top what that huge investment is, but keeping in mind that our parents, our working parents, are the ones who are shouldering a great deal of that challenge burden. Next slide.
Yep. So you can see that when the crisis hit and programs were mandated to close, that meant that the revenue source, which is basically parent tuition, really was taken out of our sector. And the National Association for the Education of Young Children, which is NACE, did a survey at the end of March when all of this first started. And they found that 33% of the early care and education programs would not survive a closing for more than 2 weeks without a significant public investment. And that because our budgets are the biggest piece of our expense is our staff salaries, that really does put all of our early care and education workforce at risk, because not only are they many programs not able to continue to pay their employees during this time, they're at risk of not even having jobs when we all come out of this. So at this point in time, there's the chance that 50% of the programs in our county, because the survey was national, but also they broke it out by state. And so there is a real risk. And you may, many of you on the call may know that the county had an early care and education initiative that was launched a year ago. And part of that initiative was to increase the number of early care and education family care providers. And the goal was to create 600 new family care provider spaces for children in our county. And so that already was an identified goal and an area where we needed to increase and expand early care and education so more families would have spaces for their children. So not only did we start at a sort of a deficit in terms of need, this is going to compound that even more, because when we do open, there may not be child care programs available to continue the services that they were doing before. So now what we're really talking about is needing public sector support, because we need to be able to ensure that programs that are closed, and even programs that are providing the essential care services right now for families, that the state is supporting, and Montgomery County is also adding some additional support to cover those fees. Even with that, that's not going to be enough to sustain the various family child care providers and centers to be able to open when businesses reopen. So in terms of our pathway to reopening, as Tricia said, there was a new report that was issued the day before yesterday, I think it was. And as we're looking and planning to reopen, those of us who have been closed, and even the programs that are providing services for essential personnel, they've already had to adapt to many of these new requirements. But these requirements, we believe, are going to be in place for many months. That means additional costs to our operations, which would cover, the new health and safety requirements that we're going to have to adhere to, that are, based on CDC guidelines. Our facilities are going to potentially need to be changed in terms of the layout of our classrooms and the size of the numbers of children and group sizes that we're going to have to maintain. That's going to be much lower enrollment. And our workforce, as I mentioned, it's predominantly women and predominantly women of color. We are also looking at the and it is an aging early care and education workforce, and all of those factors are factors that need to be considered as we're thinking about a public health crisis. And so we may not have the teachers and educators that we had before willing to come back to work, and that's going to really compound our ability, negatively, our ability to open classrooms and programs because of the lack of teachers. Again, the business model is built on enrollment, and with mandated lower enrollments, that's going to mean less revenue coming in, but our expenses are not really going to change, and they're actually going to be added to because of these additional requirements. We also anticipate that the unemployment rate among the parent workforce may be negatively impacted, and so families may not need the care and early care and education that they needed before. And so that's going to again impact enrollment. And then there's the coordination with MCPS, as MCPS has looked to expand their pre-K programs. They need community partners in the early care and education sector because they can't house pre-K in the elementary schools. And if programs are closing, that's gonna impact the MCPS's ability to be expanding pre-K, and as more families may become income eligible for this pre-K expansion due to the economic realities, that could be another area where there's a real, I guess, challenge. So the link on here is to the document that the MSDE issued earlier this week, and that lays out. It's a draft, but it gives you an idea of what the state is thinking about. Okay, next.
Yeah, I would just like to reiterate a couple of the things that that Joanne mentioned. In terms of how you look at the industry, certainly the childcare industry, we are thinking about how it was before and the reopening, and thinking about it from an economic imperative, economic opportunity standpoint. But I think we also should always reiterate the fact that, especially for little kids, and we're talking about the 0 to 5 population, this has been an incredibly difficult time, not only for them personally, but for their parents, for their educators, for their family members and friends, because even the long distance learning that might occur with some of these little kids and their caregivers is a challenging environment in which to be. And when you consider that touching, holding, caring for, nurturing for young children is so very successful when it is in a particular locale with a particular caring and nurturing educator. So just to reiterate that as a frame, I think it's important when we talk about the economics that we always also bring it back to the importance of the children themselves in this whole plan that we adults are trying to bring about. So the good news is, as Joanne said, there is, in terms of the future of the industry, relief and recovery, a very vibrant group of people working at the state level on recovery for the state of Maryland, and an important component of that is early care and education and child care in particular. We are lucky because Montgomery County does have some very astute people on that state task force, so we feel that they will very strongly advocate for the county in terms of what our particular needs are. The other thing that has occurred is here in Montgomery County, there is a recovery task force that has been formed. That task force also is paying special attention to early care and education in a broad sense, but also is honing in on childcare in particular. So that's a very good thing. I would also say that, you know, one of the benefits, if you could think of a benefit of this pandemic, has been to raise even further the profile of childcare within the county. And so when I talk about relief and recovery, I would say that there is quite a bit of sentiment among our elected officials who are very much in tune with the importance of the workforce in general being able to return to some sense of normalcy. That is incumbent on the childcare workforce also being able to do so in preparation. So immediate relief and recovery, I am sure that you all read and have read, you know, almost daily or you know, heard on television or radio about the federal relief programs that have come about, county public health emergency grant programs. State child care scholarship and county working parents assistance are actually two programs that are offered to individual families for application, with the funding assisting them to be able to pay child care tuition, and then in the end, of course, being able to benefit the child care provider. And to the degree that both of these programs continue to be able to offer the funding to the particular families and childcare programs, they do continue. So that is a very good thing. Of course, for the future, we would love to see those programs enhanced and the funding available for them to be increased. The Montgomery County Resource and Referral Center has served, it's part of the county's Department of Health and Human Services, and it has served as a very important focal point, especially for providers. And when we say providers, and Joanne enunciated this as well, we're talking about center providers such as Joanne, but also the family childcare providers. And there are a plethora of family childcare providers in the Montgomery County community. And so, we want to make sure that when we talk about these relief programs, that they are available to all manner of childcare providers. And I would say that in some cases that has not been the case. So that when local, state, or federal funding has become available, there has been access issues, especially for family child care providers who, might require or need technical assistance to apply for a particular program. And so one of the things that the county has sought to do with support from private sector is figure out how we can make sure that if funds are allowed to be accessed for childcare, that the childcare providers can actually get the funding that they need. Next slide.
And before we move on from this slide, I did want to put in a little plug. We have a lot of, I see new names on here that haven't yet engaged with our chamber chats, but if you do have any questions about whether it's the county public health emergency grant or any of the federal programs, or even some of the state programs, not only did we as the Montgomery County Chamber do webinars on each one of those with general overview and answered a lot of questions, we on our website have an incredible coronavirus related relief webpage that has all of the specifics of these programs on there in a condensed kind of as simply and as cleanly as possible. So for those of you that haven't yet engaged with our chamber, you do have access to that regardless if you're members or not. And if we can answer any questions as you're applying for those, or if you ran into hurdles in the application of those, please do let us know. So just a little plug there.
Yeah, that's great, Tricia. And I think one of the other things too is there have been federal relief programs, but there is a real push right now in a lot of advocacy for additional federal relief that is targeted to the child care sector itself.
And indeed,
that's why I'm so proud that our chamber works so closely with Montgomery Moving Forward, and thereby you, Joanne, and the other incredible individuals on that is recognizing the importance of this sector for our workforce to be able to go back to work, our working parents being able to go back to work, because the sector needs to be able to stand up on its own also. So that's one reason I know Gigi has done a lot with MMF, and then in my role at the chamber, I've taken some of it from her because I find it so fascinating. But that's one reason that our chamber works so closely and applauds all the work that you all are doing, is because this is incredibly important to our economy and economic development as a whole.
Just to reiterate, I really would say with all sincerity that one of the ways in which Montgomery Moving Forward has been able to move forward, no pun intended, has been because the chamber has really helped us in terms of public awareness and raising the profile of childcare as an economic imperative. Now especially, but even before, we were all hit with the pandemic. So kudos to Tricia and to Gigi for helping us make that happen. And I'm going to move in a minute into advocacy and what Montgomery Moving Forward and others are doing. And again, the chamber is very much part of that discussion. Also, just want to say that one of the things that we have heard from providers, from parents, from just a whole range of stakeholders is the inability to get a clarification of information and available funds. So the fact that the chamber, for example, has that kind of information available to you is really important. I mean, we often hear, we were on a call yesterday with childcare providers, many of whom were saying, where do we go? Where's the one place we can go to get all of the information, the funding that might be available, how to apply for it, and so that ease, if you will, of access is very important.
Yeah, so I'll email, when I email all the participants today, I'll email out our link to our website that has all of that information. And as we move to reopening, we just had a conversation. I know a lot of our local chambers are listening in today. We just had a conversation this morning about the resources to put out there, not only for the childcare industry, but all industry sectors, kind of the best practices on reopening. So that will be put on our website as well. It's an ever-evolving website. Alexis Reed is our Director of Marketing and Communications, and she does a fantastic job kind of having the most recent and most helpful, because there's so much information out there, as you said, that we have the best information available right on our website.
Well, I'm glad that Tricia said that, because that's a really important piece to this. And we've been on Zoom calls all morning in preparation for this, and they're like puzzle pieces. They fit together. And so you can't only talk about, you know, how does a place of business reopen? How do you reopen all of these support structures for the employees that go to that place of business, regardless of what it is? And we know from our board members and our members and our good colleagues that this is a huge issue of all those other pieces that need to be fully supported in order for there to be a recovery phased in, all of that. I mean, it's tricky. And how do you, I know that there's also an element of, you know, coordinating with other educational, with MCPS in the county. But, you know, overall, what are their requirements going to be? What are yours going to be? You know, what are private, you know, providers going to do? I mean, it is complicated.
It's really complicated. And I think as, you know, Sharon is going to talk about this next slide, but I think as we're talking about the future, we need to be thinking in really expansive ways about our early care and education sector and our childcare sector, because we should not try to rebuild what it was because it wasn't working. We need to, as we're thinking about this next phase and how all the puzzle pieces fit together, we need to envision rebuilding the sector in recognition of the public good that it is, and how we need to collectively have a new way of thinking about this really valuable and critical work. So Sharon?
Yes, that was a fabulous lead-in. Nimbleness would be a watchword here. Nimbleness, yes. Future of the industry is going to absolutely be key. One of the things, though, that a number of us have been advocating for, though, especially here locally, is some funding set-asides for the childcare sector. We have been very pleased to see that there have been funding set-asides for retail, for restaurants, and for small business, and to some degree, the childcare sector has been able to take advantage of some of that funding, especially for the small businesses. But again, to harken back to what I said about the access issue, for many family childcare providers in particular, accessing the fundings that have been available has been difficult. So Joanne and her organization, other childcare provider leaders, Montgomery Moving Forward, have been working with local elected officials to help identify what kind of funding set-asides there might be for the sector to be able to access. So we are hoping, certainly within the next few weeks, in terms of recovery and response, something tangible might come of that. The shared services model is certainly not one that would be not known to many of you, but again, under the auspice of nimbleness and flexibility, it may well be that the childcare sector will need to think about ways in which they can share services, back office services, that sort of thing, so that will allow their administrative costs to be more reasonable, thus allowing them to be able to stay into business. We're even encouraging folks and thinking about the ways in which the child care business model may need to improve, change, be expanded, be sustainable, and so that, you know, heaven forbid we should have another crisis. If things reopen, we will not have this sector go out of business. I also want to call your attention to a resource, hopefully a resource for all of you in one way or the other, at the behest of the business community, and a number of chambers here in Montgomery County, Montgomery Moving Forward innovated a business and employer and working parent early care and education toolkit. And this toolkit serves on the web as hopefully a resource for all manner of people who think about early care and education in our community. It has a number of different sections on everything what working parents might need to know and resources here locally and at the state and federal level. It has information about what employers might need to know about early care and education, and it is not the kind of resource that would be applicable only to a large business. We designed it with a lot of feedback from Tricia and other business leaders who helped us make sure that it was reflective of the wide span of business operations here in Montgomery County. And I would encourage you to take a look, especially at the section on working parents. Our hope is to be able to build on the resource that now exists to give it even more relevance to recovery for early care and education, but also we're having it translated into Spanish. And there is also interest in having this go statewide. Resources allowing, we would love nothing more than to see this web-based resource be available throughout the state of Maryland. And we're keeping our fingers crossed that this might happen in the future, but we would love you to see it as a resource now for your use. And the link to the MMF Early Care and Education Toolkit is right there in front of you. I don't know if Joanne or Tricia have anything they want to add to that, but
the only thing I would add to it is I was so appreciative of the many conversations we had around the toolkit, and what we did, at least from the chamber's perspective, is we wanted to make it as easy as possible for our business leaders and our business owners to access and learn, both as business owners, but also to share information with their employees. So the website itself, I hope all of you will visit it after this webinar. There's an entire section, which Sharon said, for working parents. So if I'm a business owner, can just hyperlink that and send it to my employees and say, here are federal, state, and local grants and tax credits that you can access. So then I'm investing in my employees in something that we know as leaders in the community that is incredibly important to our residents. And then there is a section as a business leader, what's something really, really small. We saw that a lot of you on the call are implementing flex hours or condensed work weeks. There's a lot of things, from really, really simple things you can do to if you have the ability to put a childcare facility on site. So it was an ongoing project that had a lot of business leaders taking a part of it to make sure that it would be something that you can actually use and applicable to a business. So.
Absolutely. Okay. And then community engagement is really a good segue into our advocacy slide. And I want to iterate and perhaps even that one of the things that Montgomery Moving Forward welcomes is the perspective, or are the perspectives, of the business community. We, though, have nonprofits and government and philanthropy and education and academia, we view the business perspective and the parent and community perspective as absolutely integral to the work that we do. Because as you'll see up under the advocacy agenda piece, the commitment to systems change is very, very important to us. You'd never find Montgomery Moving Forward evaluating a particular childcare program or other initiative, but you would find us asking questions about how the system of childcare or the system of early care and education more broadly is working. And everything that we've talked about thus far today really feeds into having the best possible system in Montgomery County that we possibly can. And as part of that commitment to system change, public investment is critical because early care and education is important for the public good. When Montgomery Moving Forward first began working on this issue, we really thought about the issue within the framework of two actually workforce goals. One was the workforce of today. How do we assure that those folks who are in the workplace, especially young families with little kids, are able to be productive within their work environment because they are comfortable with the childcare arrangements or the ECE supports that their children have. So the workforce of today, and then adding on to that, of course, are the childcare workforce themselves, a viable workforce and ready to move into the future. And then the second frame had to do with young children being kindergarten ready and therefore being prepared to move along in their work, both in education and career, to become the workforce of tomorrow. So the investment in the early care and education workforce itself, and those are the folks, the educators, the teachers who are taking care of our younger children, as we think about recovery, and especially since, as Joanne mentioned earlier, these were challenges before the pandemic. We need to make sure that fair compensation standards and a professionally equipped workforce are front and center. You know, we've always been, or many of us have been used to thinking about education from the K through 12 frame. And of course, more power to that, and it's very important. But research piece after economic research piece points out from scholars, economists, business people all over the world, actually, that an investment in early childhood helps you in the long run with an unbelievable return on investment. And so an investment then in the workforce is part of that. The partnership with business and employers and the flexibility and adjusted expectations, again, part of any advocacy agenda as we move forward, given what we said about the importance of flexibility and nimbleness as we recover. And then the focus on kindergarten readiness and
Sharon, before you move on from that one, we have a couple of questions just about and I'm not going to ask them specifically because they all have general themes, but the idea of reopening, right? And when we're talking about flexibility and adjusted expectations, Joanne, I know that you don't have a crystal ball and you don't know what it looks like, but there are questions on, you know, how do you balance with, you know, those that childcare facilities that might not have a large attendance going back to work because of the unemployment issue you talked about versus those that might, given a certain area, have over attendance and they have to cut back on that. So are there conversations? What does the practical part of this look like? If we were to reopen in a few weeks, how does that all roll out?
That's a really good question because I think I can see both scenarios happening where because of the mandated smaller group sizes, there are going to be families that were currently enrolled in programs that are now going to have to be on, you know, waiting lists at their programs, essentially. How that people get prioritized, you know, that's really because these are all individual businesses, whether for-profit or nonprofit. Those are decisions that they're going to have to be making. But I do think there are a couple around this flexibility. It's really, when we think about these small group sizes of 8 children and 2 teachers or 9 children and 1 teacher, and trying to keep these groups isolated throughout the day because you can't mix and mingle, do we look at potentially, you know, offering half days with like a break in between where you're cleaning and everything, and then have another group of kids come in the afternoon, you know, just so that families are getting some amount of coverage? Do we look at trying to, I honestly don't know, because there's so many different ways that it can be. And there hasn't been a lot of, there have been some conversations about what you need to do in terms of health and safety and CDC guidelines to reopen. There hasn't been a lot of conversation that I'm aware of around coordination among, you know, all the different programs that are going to be able to open and how people might support one another in order to support the workforce. People are the thing about this work is that our educators and our caregivers are really attached to the children that they've been working with, and the families are really attached to them. And so those connections are vital and really important, and are going to be so important for helping children adjust to coming back into programming and being in group care and helping with the social emotional learning and aspect of all of this. So how families might be sort of spread out among different, early care and education providers in order to try to reach more people. That there's just like the child development piece of it, and then there's the economic piece of it, and then there's the health and safety piece of it. Like there's so many factors that I think it's going to take some real community-wide conversations around that. That's probably not a very helpful answer, but it does give you a sense of like how complicated it is. And I know, there's a lot of chatter, not only in Montgomery County, but in DC too, because we have programs in DC around like how can we get back to serving the same numbers that we were, caring and educating for before in a way that is safe, and also at the same time planning that if it is true that there could be a potential spike in the future, how would we pivot once again to go back to the stay-at-home order and virtual learning. And so it's there's planning happening on multiple levels, but there's not a lot of great answers right now.
I would also add to that. It's too bad we don't have the answers. I think that probably a lot of you are advanced planners and really wanting to see through certainly the next few weeks and the next few months. But I would say this. One of the things that I think is important is for you to put out the questions and the comments that you have and the concerns that you have, whatever your perspective is. Because even though the answers may not be known this moment, this hour, this day, the conversation is happening. And so the opportunity for you all to be advocates via any number of different avenues is there. I mean, of course, through your chamber and their wonderful receptivity, but then also we mentioned earlier the county task force and the state task force that have the early care and education, early childhood, child care emphasis. There are those of us who regularly keep abreast of the conversations that are happening there and are very happy to feed information to, questions and concerns to those various different bodies. I would also say that one of the things that Montgomery Moving Forward has done recently is put together a cross-sector coalition of business, philanthropy, government, education, academia, and nonprofits to begin to talk about the absolute priorities for recovery, for early care and education, and specifically for the child care industry and the child care workforce. And so that group literally is now sort of culling all the feedback that we've gotten thus far that is enunciated by some of the things that you've just said. So please keep those kinds of questions, comments, concerns coming, and at least we can make them part of the conversation and hopefully get some more concrete answers.
Right. I have a question for Sharon and Joanne, actually to that point, which is, to what degree does the community that's in early childhood education, to what degree have you discussed the kind of standards, health and safety standards? I mean, we're really trying to bridge a gap between now and, for example, a lot of people have said, well, when there are vaccinations available, life will be simpler. And I know there's an article about that in the Washington Post today for public schools. So, and as the mother of 3 children, of course, they couldn't enroll in anything unless they had all the proof of all their shots. Well, we don't have a vaccination yet. The whole world is working on it. But I'm wondering if to what degree is the community discussing the kinds of either tests, not whether you've got it or not, because that can change hour to hour, day to day, and from test to test. Not a reliable indicator, as much as people talk about that. But vaccination, which would be out there, better treatment. I mean, is there that discussion happening in your community, and is there any agreement as you phase this in, the kinds of things that you would need to see happening in this economy for you to feel comfortable about opening and having getting back up to speed? What would be your requirements?
Well, there are currently programs that are open for the children of essential personnel. And so there are strict guidelines that those programs are following that are have been sent out by the CDC. And those, I believe, will be the same requirements as we get to a more broad opening. So, but when it looks like it'll be stage 3 of like the state's reopen plan, when all programs will be able to open and be at their regular capacity. But I think what's going to happen, there's going to be, even at that point, I think we'll probably still be doing daily health checks when children first arrive, when teachers first arrive. We're going to have some standards and protocols that are going to be long lasting. And I do think once one of the other pieces of this, it could shift what infant care looks like too, because children that are under 1 year, they don't necessarily, they don't have all of their immunizations yet. So is that group, and so what are those implications of that in terms of, paid family leave when you have very young children? So, it is this complicated network where there are different policies that all feed into, like you mentioned, the puzzle before. So I don't think I think it will be 12 months before we look anything like what we looked like at the beginning of March.
And I think that feeds into, and I'm mindful of time, so what I'll do, if we don't get to your question on here, I'm going to email the questions to Sharon and Joanne along with their contact information, and they might be able to provide more specific feedback. But to that point of not getting back to where we have been for at least the next 12 months, there's a big question, and we touched on it briefly, and we don't have time for it in the next 8 minutes, but this financial piece. So the childcare as a business itself, if it's needing to have a smaller size, that's less revenue coming in. And then there's also some questions that we've gotten about parents being able to afford childcare, and kind of if you're having less students, does that mean the cost goes up? And then how can parents afford it if they've lost one or some of their jobs? And the whole financial piece of this, it could be its own webinar, but I do want to add voice to some of the questions that we've gotten in that spirit.
Right, and I think that that's really true. Like the answer to saving this sector should not be parent tuition.
Right.
And, it goes back to that public good, and that's where I think everyone on the call, thinking about this advocacy at, we recognize that the county has its so if we're thinking about a recovery, there are roles that each of our sectors and where we are in our positions can play to try to stand the sector up. The biggest piece needs to come from the federal government. And so I think all of us can be really lending our voices to that advocacy, because there are studies and reports. The National Women's Law Center did do a study that said right now it's going to take close to $10 billion a month to sustain the sector across the country. And so Congress is looking at this, not fully funding that, but is proposing, big dollars, but yet it's probably not going anywhere in the Senate. And so we are, we do need to be pushing at the federal level, I think.
I would also emphasize the importance of something that's not necessarily happening now, perhaps more so at the federal level, and that's what we call the coordination of funding sources. So that, if there is a pot of money that is being offered by a particular federal agency, is that funding source and its requirements being done in concert with federal agency B? So, was the CARES money, or is the CARES money that's coming through, is that coordinated with the unemployment dollars, for example, that might be available? So we're also pushing for not only effectiveness of information sharing and ease of information sharing and access, but the coordination piece is really pretty important. And here locally, what would not be good is if there were funding sources identified and innovated, absent a coordination with the funding sources that might be available that have either state flow through or are innovated by the state. So again, from an advocacy standpoint, the specifics we're talking about are important, but so are these systematic ways of information gathering and coordination of resources.
Right, because the part, and then the fallout in particular, I think, there are reports saying that women are going to be, working moms are going to be most greatly impacted by this, because most likely they would be the ones stepping out of the workforce in order to care for children at home. And so that loss of income, that loss of career ladder and potential long-term earning for working moms is a really big and important issue that I think people need to pay attention to, because that this all of the coordination that Sharon was talking about, I think it's imperative that we're informed about these different funding streams or these different ideas and see how they can scaffold and support one another in ways that are creative, so that we are able to rebuild this sector in really smart and innovative ways.
Well, and to that point,
you brought up gender wealth disparity. I mean, I think that gender wealth disparity issue is just, can't be ignored here. It will have a huge impact. I do think there'll be stay-at-home dads too.
Yeah.
I think there'll be grandparents that were maybe nearing retirement, and then suddenly they have to step out sooner, so that I think there's going to be a lot of disruption, and that'll affect their retirement. Yeah. So I think that you have a couple of categories, but I really am concerned about the disparity, gender disparity in building wealth and losing all that ground. And it's always been an issue. It's not just now or just this. It's been
absolutely.
You're right.
And Gigi, to that point too, and I'm mindful of the time here, but this does tie into another conversation with that we've had with some of our members around Montgomery County Public Schools. And when you do have kind of the virtual learning, if we do see a resurgence of this in the fall, and MCPS and other school systems have to go back to virtual learning from home, we've heard that when two parents are fortunate enough to each have a job that they can telework, or if you have a single parent that has the ability to telework, kind of balancing, assisting the children in virtual learning with being able to kind of produce at their job is also a dynamic too that unfortunately I think hits women a little bit harder too. But we could go into that for another hour or so. But Gigi, I just wanted to thank Sharon and Joanne. Both of you are so incredible at what you do and are such pillars in our community. And it's been really a pleasure that the Chamber's been able to work with each of you and have you better inform us on the childcare, the components of it, so that we can inform our members as whether they're going back to work themselves as a working parent, or they're a business owner that has employees that now kind of better understands how all of this is fitting together, and they can provide some additional supports or flexibility to their employees. I really do appreciate your time today. Gigi, did you want to close us out?
Big thank you to you all. And I want to thank everybody for joining us today. It is a conversation, and that's where change begins. And we have a lot ahead of us, and we're stronger working together. So I want to thank everybody for tuning in today. Please send us your comments, your questions. And we'll move forward with it. Again, Sharon, Joanne, thanks so much, and wishing all of you a safe and healthy and happy Memorial Day weekend.
Thank you.
Thank you.
Thank you.
Thank you.
Yes.
Okay. Bye.